Depression is one of the better known and more discussed mental illnesses in our society. However, there are still a lot of people who do not completely understand what the disease is, what its symptoms are, and how it can be treated. Depression is a disease, and it should be treated as such. It doesn't matter who the person is, depression can affect them. It doesn't think about race, social class, or sexuality. It can affect anybody. And it doesn't just affect the person with depression. It affects everybody in their lives. It is very possible that you may know somebody with depression, or if you do not now, you may know somebody in the future. I am somebody who knows firsthand how scary dealing with depression is, being somebody who's both been treated and is being treated for its symptoms, and as somebody who knows multiple people with depression. There are multiple ways depression can be treated. There's the common approach of psychotherapy, and then there's the alternative method of medication at home. The lack of understanding of these treatments and the mental illness itself is a huge culprit for stigma that are still in our society. So discussion begins with two main questions. What is depression and what is its symptoms? Authors Dwight L. Evans and Linda Andrews, in their book, If Your Adolescent Has Depression or Bipolar Disorder, they address that, again, depression is an illness and a disease, and it needs to be treated very seriously. It's more than just the occasional blue mood. It's something that is very constant in the victim's life, and it affects their everyday life some way or another. So they also note some symptoms that include loss of interest, lack of energy, changing in sleeping patterns or sleeping disorders, problems concentrating, feelings of hopelessness, suicidal thoughts, and there are many more. And I also want to note that just because one person with depression has a certain group of symptoms doesn't mean that another person with depression has the same symptoms. It varies from person to person. So now that we understand what depression is and what its symptoms are, a new question rises. How is it treated? The National Alliance on Mental Illnesses discusses two common approaches to psychotherapy, also known as talk therapy. Talk therapy is when a patient or the patient and their families or friends or whoever go into a room with a therapist, sit down, and talk. So one main common approach to psychotherapy is cognitive behavioral therapy. So cognitive behavioral therapy takes a look at the negative thought processes that are associated with depression, and they work on addressing those negative thought patterns and working on changing them so that whenever they arise up in the patient's mind, they can address it and change it. There is also psychodynamic therapy, which focuses on understanding and addressing negative behaviors associated with past experiences, whether that be trauma or just insecurities, and it finds solutions to those past experiences so that the behavior can change. There are also alternative approaches to treating depression, and one of those is at-home medications. Now, I do want to put a disclaimer. If you think you are depressed, I advise you to get professional help. I don't suggest just going straight to at-home medications. If your depression is serious, seek a professional. So, the article, What to Do When You Feel Blue. Do you know that certain foods, herbs, and other natural remedies can help ease depression? In the Natural Health magazine, they suggest that fish oil supplements and salmon can actually ease depression symptoms as it contains a fatty acid called DHA. So taking a fish oil pill once every day or eating salmon a couple times a week can actually improve depression symptoms. They also find that negative HTP and SAM-E were natural compounds that have research backing up that they work almost as well or as well as antidepressants. So you don't have to turn to drugs to treat depression. I know that is a huge thing that people get kind of weirded out about when it comes to depression. They don't want to get them on drugs, etc. There are other ways, obviously. Depression is a mental illness that is much more well known in our society than others, but there is a huge amount of stigma still surrounding it, and that all comes from a lack of understanding what the mental illness is, what its symptoms are, and how it can be treated. Depression is easily a sensitive topic to talk about, and it's one that a lot of people shy away from. But there needs to be discussion. There needs to be discussion and understanding and knowledge about this mental illness so that we can get rid of the stigma. It all starts with a basic understanding.